than it should be, or the narrower the arteries, causing the heart to pump harder, that is going to cause a higher blood pressure. So what is a healthy blood pressure? Most physicians agree that approximately 120 systolic over 80 diastolic will reduce the risk of injury to organs and blood vessels. They come up with this number by looking at thousands, if not millions, of people and seeing at what point do people start to have adverse side effects from the high blood pressure. You don't necessarily have to be in the 120 to 80 range. There's something called prehypertension, which is 120 to 139 systolic, which is the top number, over 80 to 89 for diastolic, and there's different stages of hypertension as well. The most serious, of course, is secondary or stage 2 hypertension, I'm sorry, which is 160 systolic over 100 diastolic. And there's something also called secondary hypertension, which is from a known cause, such as another medical condition such as renal artery stenosis or primary hyperaldosteronism. You don't want to instantly assume that because someone has high blood pressure that they're not taking care of themselves, they're eating unhealthily, they're not exercising. So we do want to investigate other causes of hypertension just in case they can be cured medically from another reason. And this is basically just a little chart that shows what was in text in the previous slide. As you can see, a normal or a healthy blood pressure is around 120 over 80, and then the different stages of hypertension up into a hypertensive crisis, which is when if you have someone come into the clinic and their blood pressure is higher than 180 for systolic or higher than 110 for diastolic, that's really an emergency, and that patient may be experiencing symptoms, and they may be experiencing organ damage such as damage to their kidneys, heart, brain, etc. And it should really be quite alarming, and the proper people should be notified. So what else can cause hypertension? Like I said, there's the secondary hypertension, which is due to any various numbers of things. This is a pretty short list of the main things that can cause hypertension that aren't from lifestyle causes or anything else that physicians do often look at, because like I said, you don't want to instantly accuse someone of not taking care of themselves when in fact they are, and they may have a cancer that is causing them to have hypertension, or sleep apnea, or any number of causes. So how should blood pressure be checked? This is a very common cause of hypertension, in that the patient may not necessarily have hypertension, but the blood pressure is checked incorrectly or not adequately enough, and that will cause an improper reading. So someone who may not have hypertension may have hypertension if the cuff size is wrong, if the artery mark is not where it should be, if the blood pressure is checked incorrectly when the pressure is released, it may lead to inaccurate readings. And again, these people should, they of course should make lifestyle changes if they have poor lifestyle choices currently. However, they don't need to be on medication. We don't want to put anyone on medication, obviously, if they don't need it. So why does hypertension matter? Does it really matter if you have hypertension? It seems most people have hypertension and they're living with it. What's the big deal? So hypertension is a silent killer because many people do not feel any side effects of hypertension before something serious happens, such as a stroke or a heart attack or an aneurysm develops. So and that's the reason. A lot of people, they do live with hypertension, and it's uncontrolled, and they may not know that something is seriously wrong and that they need to undergo some medical treatment or make some lifestyle changes. There is No, it's not necessarily a myth, but some people do claim that they can feel when they have high blood pressure. And obviously, if you have a regular blood pressure and then you get angry, and your heart's pumping and racing, and you feel a little lightheaded, of course, that's going to be related to a higher blood pressure and higher cardiac output. Your heart's working really hard to pump all this blood. But we're talking about chronic hypertension when we talk about that, and so there may be some truth to it. We have yet to prove it with consistent medical studies to be able to show that. However, we do know that it can permanently damage any organ, so it's very important to emphasize to anyone and everyone that does have hypertension or pre-hypertension that they really should start to look into it. So, what else can happen? We saw some examples like the stroke, the heart attack, but what else can happen? And this is just another short little list of things that can happen to a patient that may have hypertension that is uncontrolled. Congestive heart failure, their aorta, which is the major blood vessel that comes off of the heart that supplies most of the body. It may actually just tear into two parts, and of course that's not a good thing. Of course, memory loss, erectile dysfunction, vision loss. So how well does Louisiana do in comparison to the rest of the United States? This is from the UDS, and this shows that not only does Louisiana have a higher rate of hypertension, around 27, 28%, compared to the national average, that's 22, 23%. There was an 8.8% increase in the last 3 years from 2011 to 2013, whereas the national increase was 7.5%. So what this means is that not only does Louisiana have a higher rate of hypertension, the rate of increased hypertension is increasing. So not only is it just that necessarily people in the South have higher blood pressures, it's that the actual rate of people getting hypertension is higher than the national average. So there's something at play here that we need to take a look at. Another thing that the UDS tracks is rates of diabetes. Of course, diabetes and hypertension often go hand in hand because diabetes often also is associated with poor lifestyle choices, not getting enough exercise, not being able to eat fresh fruits and vegetables, and those sorts of things. So how do you know if someone has hypertension? So, as mentioned previously, there are no immediate symptoms of hypertension, but it constantly works away at those organs. It'll constantly just keep pounding and pounding away until one day a serious event happens. And because most symptoms of the hypertension develop over a long time, it's hard to notice. Every day, you get up and go to work, you come back, nothing is wrong until, 10, 20 years down the line, you have a stroke, and that's when the hypertensive crisis, as mentioned earlier, comes into play. So when someone starts trending towards the higher end of the spectrum, you really want to be alerted to that. And they may get, the beginning symptoms may include severe headache, shortness of breath, nosebleeds, and severe anxiety. So what puts someone at risk for hypertension? How can you prevent this really silent killer? So the risk factors that, you cannot change, obviously, are your age, your gender. So typically males have higher rates of hypertension. Your heredity, that's a little bit questionable because of a lot of studies that are currently being done. African Americans in America typically have higher rates of hypertension. However, if you take a look at a similar population in Africa, they do not. So there's still a lot of research being done in this area. Of course, being overweight or obese does lead to hypertension. Smoking is, you can change that. You can try to quit smoking. High cholesterol with a poor diet, diabetes, of course, with the relation there, and physical inactivity. And other causes of hypertension, as mentioned previously, can be any number of these other various things. So the risk factors, this is just a little bit of an explanation, and I'll just go briefly through all of these. So as you age, of course, as you get older, your blood vessels get a little more flimsy, so they just don't hold the blood as well, so that may lead to hypertension. Race, as I mentioned earlier, African Americans typically have higher blood pressure, and it develops at an earlier age than it does in Caucasians. And complications in African Americans are also more common. Family history, if you have a family history, if your parents had hypertension, if your grandparents had hypertension, you're more likely to have hypertension, and that's possibly the genetic causes, but it's also because of similar lifestyles. You know, for the first 18 years of your life, if your parents were, you know, eating unhealthily, and so your family typically will trend more towards the unhealthy side. If if they weren't very active, you probably weren't exposed to as much physical activity as you could have been. The overweight or obesity, that's related to, you know, as I was saying earlier, the more blood or, you know, the more water that's in the hose, the more that needs to be moved by the heart, and that just leads to more pressure on the arterial walls. Not being physically active, people that just sit around all day, and that may not be necessarily due to laziness, but if you have like an office job, if you have a job that doesn't involve standing or some kind of physical activity, you'll typically have a higher heart rate, and that's just because your heart's not accustomed to being worked as hard as if you were more physically active. And the lack of physical activity, also contributes to the risk of being overweight. Other risk factors, tobacco is a huge one that a lot of people may not necessarily think about. Smoking or chewing tobacco not only immediately raises the blood pressure at that time, but the chemicals in the tobacco also damage the lining of the arterial wall, and this causes them to become narrow as they attempt to repair themselves. Of course, sodium, that causes your kidneys to retain the fluid, and again, too much volume in the blood causes hypertension. And a little known one is too little potassium, and that's because the kidney kind of plays a balancing game between sodium and potassium. So, if you have too little potassium, it's going to hold on to the sodium, and that's going to increase your blood volume. Some other ones that people may not necessarily think about is the alcohol. Over time, alcohol does damage blood vessels, and this can cause hypertension. Men should have no more than 2 drinks a day, and down a little lower, you can see what constitutes 1 drink. Stress, high levels of stress leads to temporary increases in blood pressure, but this also, chronic stress can lead to chronic high blood pressure. And other chronic conditions, again, as we mentioned, we don't want to instantly identify someone as being lazy or this, that, or the other if they really have another medical condition. And pregnancy can sometimes cause high blood pressure as well. So are children or adolescents at risk, or is this is this a disease that really only affects older people? So unfortunately, high blood pressure can cause damage or organ damage in children as well. It's not as common, but because of the growing number of kids that are becoming overweight or becoming obese, especially if they sit in front of the TV or the iPad or iPhone or anything, and they have poor lifestyle habits, it's very difficult to get them to a healthy diet and to do more physical activity. So this is something that can definitely cause hypertension in children, and that we need to address. So this is just test for hypertension in case the patients are asking you, so if I have hypertension, how do you know? Like, is the blood pressure cuff accurate? So these are just some things that you can tell them or show them, and that we mentioned earlier, that you can show to see if they really do have hypertension and the true causes of it. So we talked about the risk factors for hypertension. So what happens if you have hypertension and you don't control it, and it just becomes out of control, and over time, as I mentioned earlier, you may have heart attacks because of the atherosclerosis and your heart's working harder, and eventually even vessels inside of the heart may become completely occluded, from the atherosclerosis, and this is going to cause a heart attack. Aneurysms. So aneurysm development is a bit interesting because the way that aneurysms form is because the creating of the bulge directly after a large atherosclerotic plaque. So when the plaque occludes a lot of the inside of the blood vessel, it actually balloons out because it releases tension, and this obviously is bad because over time it will grow and grow and grow. So when it's small, it's actually relieving tension, but as it grows larger, it's actually causing the tension to become greater, and over time it will burst, causing what so many of us have seen, brain aneurysms and so on. Heart failure can also happen. This is kind of related to heart attacks, except that it's not the heart that's not getting enough oxygen because the artery is not pushing enough blood, but it's actually because the heart is working so hard to be able to push all of the blood through, all of the narrowings, all of the atherosclerosis inside of the arteries, that it eventually becomes really big, and then it becomes very inefficient, and this causes heart failure. Some more things: kidney damage. Of course, kidneys are very important, and the way that they become damaged is very similar. Atherosclerotic plaques cause not enough oxygen to reach the kidney, and it becomes damaged. And this is also what happens in the eyes, especially the eyes, because they don't get a massive amount of blood. They only have a certain number of vessels, and eventually, if those vessels become completely occluded or too hypertensive, you're going to lose vision and blood supply in your eyes. So metabolic syndrome, this is just kind of a mishmash of disorders that include, obesity, high triglycerides, low HDL, which is the good cholesterol, and high insulin levels, which is typically associated with diabetes. Cognitive function also, of course, if you don't get enough blood to your brain, of course, we can all, see how that affects brain function. So what can someone do about hypertension? You can change your lifestyle, of course. You should always advocate to patients and to friends, family, everybody, that they should be changing their lifestyle, especially if it's just one small thing at a time, because that's really the easiest way to do it. If you make these huge sweeping changes, you may stick to it. Patients may stick to it for a little bit, but then, over time, they'll revert back because it's so hard. If you go from eating fast food every day to trying to eat fresh fruits and vegetables every day. So the changes that we want to see that people with hypertension make include healthy diets with less salt, because of course salt causes your kidneys to retain the fluid from earlier. Exercise regularly, and that'll just strengthen your heart and make it pump as efficiently as possible. Smoking cessation, of course, as we mentioned, smoking damages the blood vessels, and maintaining a healthy weight so that you don't have too much excess blood volume circulating through the body. In addition to diet and exercise, if those don't do it, of course they help, but if your blood pressure is really high and it's still uncontrolled, your physician or nurse may suggest medications. And so what are the goals? So if you're a healthy adult over 60 years of age, the target is less than 150/90. If you're younger than 60, it's 140/90. I know we mentioned earlier that 120/80 was the ideal. However, we want to take it one step at a time. Of course, ideally they would get to 120/80, but the American Heart Association and other organizations do feel that these targets are sufficient as a starting point. So you've made lifestyle changes, but your hypertension is still uncontrolled. What should you do? So there are medications to treat hypertension, and a lot of people are on these medications. They do have some side effects, and we'll talk about those a little bit later. The most common that are used to treat hypertension include the thiazide diuretics. Often these are called water pills. Basically, a diuretic is just something that causes your kidneys to excrete excess fluid. So if you're drinking a lot of water, but also a lot of salt, this will just help you get rid of that excess water, especially if you have a high salt diet. This will help get rid of the excess water that you don't need. Beta blockers, those are also typically used. I also have some trade names in there. Beta blockers are very commonly used because they reduce the workload of the heart. They cause your heart to slow down a little bit and allows your heart to take a little bit of a breather. ACE inhibitors are also typically used, and these work similarly to the thiazide diuretics, except that they don't make you urinate more, and they are actually more effective in patients with diabetes. So this is typically the first-line treatment in patients that do have diabetes and hypertension. Again, these are just a little bit more medications. I don't expect anyone to know every single one of these and know exactly how they work. It's just a little bit of an introduction to see what can be used. They have angiotensin II receptor blockers, calcium channel blockers, renin inhibitors, and all of these really are either working in the kidney or have some interaction with the kidney to either cause the kidney to cause blood vessels to not be so tight and strict or constricted, or they cause the body to just get rid of that excess fluid so your heart doesn't have to pump as much blood through your blood vessels. So the most important thing to maintaining normal blood pressure is going to be the lifestyle modifications. Of course, if you want to assist a patient with medications, that's great. But ultimately, it's up to the patient to make these changes by themselves, or not by themselves, because obviously they'll have assistance from family, friends, and medical staff. But they need to be taking the initiative themselves, because obviously you can't force someone to keep having a healthy diet, maintain physical activity. If they do smoke, to force them to stop smoking, maintaining an adequate level for their weight, as well as cutting down on the alcohol. So really the onus is on the patient to be able to do that. And for a diet, so of course everything has nutrition labels on there. In general, you want to have less than 2,300 milligrams of sodium, ideally less than 1,500 milligrams of sodium. And I know that's really hard in today's world, where everything has extra salt, extra sugar. But it's really important to stress that the healthy diet is one of the most important things that can be done. Physical activity, of course, you want people to get around, to get moving. Even if you have kind of a sedentary job, like at an office, perhaps just taking a 5-minute break every half hour or an hour and just walk around the office a little bit, or go downstairs, go outside, just clear your mind a little bit. Smoking cessation, of course, is very important, and this can also be used because it also saves money, of course, if you're not buying cigarettes, as well as the same for alcohol. And maintaining a healthy weight, that typically actually happens when patients start doing more physical activity and healthy diets. So really that one just kind of comes on its own if you can get the patient to do the other two. So there's resistant hypertension as well. So if a patient has done everything that they have ever heard of, they've made all these lifestyle modifications, they have been taking medications, they've not only been just taking 1 or 2, but they've taken 3 medications, and they still have hypertension. It's possibly because they have an underlying medical cause, like a tumor, like we mentioned earlier, or they have something called resistant hypertension, and this is just it's not really understood very well, but it's due to one risk factor or another being really heavily weighed in that patient. Obviously incorrect dosing of drugs, incorrect combinations of drugs. If a drug has an interaction with another drug, it may cause some improper interaction, or if the patient is not necessarily taking the drugs adequately, if it says take it once a day, but they only take it once every 2 days, once every 3 days, once every time they remember. Of course, you want to make sure that everything that you can do is in the proper place, so you don't go chasing down, something called resistant hypertension when you don't need to. It was a pretty short presentation. Do you have any questions for me?
Okay, Jack, I see that we have a few questions, so I'll go ahead and read the first one. But just as a reminder, if you have any questions, please feel free to type them in the question box located on the webinar screen. First question we have are, what are the side effects of high blood pressure medicine?
Okay. I'll go ahead and just go back to that slide with the medications. Here it is. Basically, no medication is without side effects, and that obviously includes these. So the main ones that we talked about that are mainly used as the first-line treatments are going to be the thiazide diuretics, and as we said earlier, these are typically called water pills by patients, and so this just causes a patient to urinate excessively, but this can also cause other problems related to that water excretion. This may cause, erectile dysfunction in some men. They may cause weakness or leg cramps or fatigue. It does interact with the sodium and potassium, as we mentioned earlier, so it is important to monitor those in a patient if they do experience side effects, because that may be the cause. Also, they can cause, foot pain. They can exacerbate gout. And these are just the thiazide diuretics. For beta blockers, as mentioned, they do make your heart beat a little less slowly and less forcefully. It gives your heart a little bit of a break. These may cause side effects such as asthma symptoms. They can cause your hands and feet to be cold. The way they exacerbate the asthma symptoms is because when you get asthma, it works on something called a beta-2 receptor that's inside of the lungs, that's also inside of the heart, and of course, if you're blocking both of them, you may exacerbate some asthma symptoms. They can also cause, again, erectile dysfunction or erection problems, and they may also cause insomnia or sleep problems. For the angiotensin converting enzyme inhibitors, commonly called ACE inhibitors, these medications typically cause a cough. That's the most common complaint that patients may have if they do take this medication. Also, a skin rash and loss of taste are the other two possible side effects of ACE inhibitors that people typically see. And at that point, you would probably switch a patient to another drug, usually like an angiotensin 2 receptor blocker, or a retin inhibitor or calcium channel blocker. It's important to, if a patient has an adverse reaction to one medication, to switch them to another medication, not only because it's going to keep the blood pressure down, but if they remain in the habit of remembering to take their medications, it's really useful for continuity of their medication. Of course, calcium channel blockers, these may cause constipation. That's the most common side effect that we typically hear from patients, as well as dizziness, headaches, irregular or rapid heartbeat. Some patients may complain of palpitations. That may also be seen. One thing I did forget to mention earlier is grapefruit juice, which does have an interaction with certain calcium channel blockers. It causes their metabolism to be quicker than it should be in the liver, and that's something to also watch out for if a patient is on a calcium channel blocker. And one of the questions you may have to ask, do you drink grapefruit juice? If so, it may cause the medication to be more quickly eliminated from the body, leading to improper dosing and subsequent hypertension. The last of the medications that are typically used, renin inhibitors. Those typically also cause the cough or the diarrhea that's also seen with the ACE inhibitor. So it's really difficult to find medications or the right medication for each patient, and you really have to tailor it to each and every patient.
Okay, thank you, Jack. Our next question in the queue is, how do you deal with the quote-unquote white coat hypertension?
Right, and that so white coat hypertension, for those that may be unfamiliar with it, is when a patient comes into the doctor's office and a staff member that works at the clinic obviously will take the vitals, which includes blood pressure, and so the patient being at the doctor's office, not many people enjoy going to the doctor's office, so understandably they may be nervous. They may be having a lot of thoughts racing in their minds if they had to walk upstairs. Anything that can cause a patient to be more nervous or anxious. As we mentioned earlier, stress can acutely, suddenly raise your blood pressure. Obviously with chronic stress, you'll have chronically raised blood pressure. But it's very difficult to manage the white coat hypertension, which is, someone with a white coat walks by and patients become nervous. They don't want to be at the doctor's office. They're nervous. They may get a diagnosis of something they didn't come in for. They don't want to find out they have cancer. This, that, or the other. It's really difficult to deal with. I think the main thing that that we try to do to avoid dealing with that kind of scenario is to have the patient to try to be more relaxed, especially if whoever is taking the blood pressure sees that the patient, is noticeably anxious, to try to calm them down a little bit and really, allow them to rest a little bit. If they're hot and they're sweaty, they'll be a little more anxious. So really, I think just waiting to take the blood pressure, or perhaps, just try to reassure the patient that everything's going to be fine. Everyone at the clinic has their best interests in mind, and no one is no one is trying to intimidate them or make them anxious.
Okay, thank you. Our next question is, are there any medications in particular that causes an increase in blood pressure?
Right, and that's a good question because there are some medications that do cause uh, blood pressure to be falsely elevated. Some of these, the most common that patients typically do take are ibuprofen, so that's the Advils and the Motrins, as well as naproxen, which are the Aleve. And in general, these are the NSAIDs, the non-steroidal anti-inflammatory drugs, and they're over the counter. They're used for pretty much everything. Cold medicines can contain these NSAIDs. But they do cause your body to retain fluid, and they do decrease the function of the kidneys, and that's going to increase the amount of blood that the heart's going to have to pump. So that does occasionally lead to hypertension. The effects may not be super pronounced, if they only take it once a day or if they rarely take it. Another medication that is typically seen that patients do take are the cough medications, and again, these contain NSAIDs or cold medications, but also decongestants can also do it because the Sudafed does contain pseudoephedrine, which is again working on that beta receptor that we talked about that causes the heart to have to either work harder or not, depending on if you're blocking it or not. Migraine medications can also do it, just based on how they work. Weight loss drugs, appetite suppressants can cause this, and a whole myriad of drugs. But those are typically the most common: the cough and cold medications, as well as the ibuprofens, the Aleves, and all of that.
Okay, that looks like all of the questions we have so far. We will take another minute or so to see if we have any other questions that come up.
Jack, while we're waiting, this is Tanya. Can you speak to JNC8, who they are, what they do, and why they're important?
Sure. So JNC stands for Joint National Committee. Um, the 8 obviously signifies that this is the 8th time that they have met to discuss the recommendations put forth by the medical community that deal with hypertension. And so they come out with recommendations, and this is how uh, all of this other information is gathered, because they look at all the studies that have been done so far, especially those that have been published since the last JNC recommendations. And they're typically published in the JAMA, which stands for the Journal of American Medical Association. And they get, I think it's maybe 500 or so physicians, as well as nurses, and anyone who has expertise dealing with hypertension, and they put forth recommendations that cover pretty much any scenario that you may have. So, if a patient does come in and they do have secondary hypertension due to some other medical condition, instead of being unsure of what to do, you can always just look up JNC8 and look up their recommendations, and that'll tell you what the recommendations are, and their recommendations are graded based on the strength and how sure they are of each recommendation. And that's another way to take a look at it, because if someone has if they're taking X, Y, and Z drug and they've been treated like this and they're this years old and they have 160 over 100, what should I do? And the JNC8 will be able to have recommendations, and they also give reasoning for each recommendation they have, along with a list of all of the publications and research that has gone into each recommendation that you can read up on. So if you're not entirely sure of what to do with a patient, you can always take a look at the JNC8.
Okay, thank you. That was all of our questions. It appears that's all the questions we have for today's webinar. We want to thank everyone for participating in our Lunch and Learn session. Our next webinar series will be on August 14th, and we want to just thank you again. This concludes our Learning Series webinar for today.